So, hello again, Giorgio Grossi here. Yes, I'll give the speech again, but try and be concise in the beginning. So, a few words on burnout. Burnout is a multifaceted concept, and it's used in various contexts. So, partly it's used in a number of subcultures, but it's also the topic of investigation in work psychology. And there's a number of authors, such as Herbert Freudenberger, Christina Maslach, and others, who have done and still do, at least a few of them, a whole lot of research on this phenomenon, which is conceptualized in terms of a syndrome consisting of emotional exhaustion, increasing cynicism, and a sense of decreased professional efficacy in all kinds of occupations, but mainly among people doing people work. Okay, and now, although the participants in the studies don't feel that well for obvious reasons, the main bulk of the research is focused on people still at work and thus faring relatively well. But what is frequently experienced in the wake of, for instance, a very challenging period, such as the pandemic, is the clinical aspect of burnout. And clinical burnout is not a condition in itself. It's not a diagnosis in itself, but is conceptualized in various ways in different countries. So in Sweden, for instance, we have a diagnosis for it, and it's called exhaustion disorder, and I'll take you through it. So the main symptoms of exhaustion disorder is a severe sense of fatigue. It is actually a deep state of exhaustion, which is different from the normal fatigue, tiredness that one can experience after having gone through an ordeal of any kind. That is exhaustion disorder you can't really rest from. And it's so deep and it's so pervasive that you cannot command yourself to do things because there's simply not enough energy. One of the main features of exhaustion in this disorder is the mental weariness, the cognitive impairments, as it says in the pictures. And this is manifested by severe problems with memory and concentration. And this is sort of a handicap because it becomes increasingly difficult to function in everyday life if you can't rely on your memory. You don't remember where you have put things, you don't remember what your daily schedule contains, etc., etc. And you have you find it really hard to focus on anything. And in combination with that, we also have the increased sensitivity for stress. So that means that if you are afflicted by exhaustion disorder, you will probably overreact to situations in which you normally don't react that intensely. So you become stressed out more easily than you would normally. And when that happens, your cognitive performance is impaired even more. Besides this, these are the cardinal symptoms. Besides them, we also have a number of others. So in order to meet the diagnostic criteria for exhaustion disorder, you also have at least 3 of the following most days of the week for a period of at least 1 month. So you have the sleep disturbances, which are most frequently characterized by insomnia, but there are many instances of hypersomnia too. And that depends a bit on what phase of exhaustion you find yourself in. And I'll talk about phases in a very short moment. And besides the sleep disturbances, you have also a physical fatigue and fatigability. So you can't do things of a physical nature to the same extent as you used to, and you become drained of energy very easily. There is a heightened sensitivity to sensory stimulation of all kinds. And one of the typical ones is the increased sensitivity for sounds, for instance. And on the fourth place, we have physical symptoms. Stress is a phenomenon that affects the entire body, and long-term stress without restitution does so even more, in the sense that you may develop more or less chronic pain conditions, pain in the neck and shoulders, headaches, you may become dizzy, have heart palpitations, find it hard breathing, have problems with digestion, for instance, and others. Now, the development of exhaustion disorder follows a set of typical phases, which you can see depicted in this picture here. And you see there's a line. You can see that as your energy levels, the degree of vitality that you dispose over in your everyday life. And as long as you're healthy, maybe you're not as happy and energetic every day because it goes a bit up and down, but still you have enough to function properly in your everyday life. Then we have a risk phase that initiates when you enter a longer period in your life when stressors are accumulating. For instance, during the pandemic, this was quite obvious, working within the public health workforce. I mean, we are all aware of the challenges that posed and continues posing. So you have a number of stressors that you have to deal with, and in order to do that, you may also, prioritize in a different way, in the way that all activities of recovery type, sleeping enough hours, spending time with people who make you relax, spending time with friends, family, exercising, devoting time to hobbies and other things that are all, encompassed within the umbrella term recovery behaviors. Those are not prioritized in a crisis situation. So it's all work, 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 problem solving, and dealing with issues at work and outside work without recovery. So the risk phase implies that under a prolonged period of time, months, years, that's what life looks like. And that's when also all the symptoms that I was mentioning a moment ago started developing. They come slowly. You are agitated, you can't sleep properly, you become anxiety-ridden, and the fatigue ensues, the problems with memory, concentration, etc. You become more irritable, anxious, etc. And over time, these symptoms that initially are some kind of warning symptoms aggregate one to the other, they increase in intensity, and life becomes more and more difficult to manage. Still, if you don't do anything about it, or if you are not seen in your burning out process by a manager or somebody who stops you and gives you opportunities to rest and unwind and recharge your batteries, you'll probably end up in the acute phase of the exhaustion disorder, and that's when you reach the absolutely, the bottom, so to speak. That's where your energy levels are absolutely depleted, and that's where you have to see a doctor, take tests, blood samples, etc., in order to see that there are no other somatic or psychiatric conditions that could explain the fact that you are so fatigued, and probably you end up on sick leave for a period of time. And then you see there's the recovery phase, and the recovery phase is not a straight line up to your initial energy levels. It the recovery phase goes up and down, and it takes a whole lot of time. And how long time it takes, that depends a lot on the kind of life you lead, at work and outside work. So if you come from the pandemic in a state of exhaustion and then are expected to continue performing at the same level under the same type of hyperarousal, although there's no pandemic going on, well, that's a context within which you'll have an extremely hard time unwinding and recovering from your exhaustion. Chances are the situation, your health status will worsen rather than the opposite. Because the thing is that there's a number of stressors that increase the risk for us to developing a state of deep exhaustion due to chronic stress. But then when the state is there, when the exhaustion is in place, and the same risk factors are still there, the same stressors are still there, they work as maintenance factors. Okay, and then there are new mechanisms entering the scene, which together can maintain the exhaustion disorder for, in worst cases, the rest of your life. Let's be fair, that's a fact. So let's take a look at them. So the life puzzle in general, and being a woman, may actually increase the risk both for developing an exhaustion disorder, but also maintaining it. So some 75 to 80% of patients are women, and that depends partly on the fact that the labor market is gender segregated and the most stressful occupations are female ones, okay? And then women are, if we generalize, more socialized than men to take a greater responsibility for the home, the family, elder relatives, etc., etc., etc. So the stressors may be more and heavier to carry for women than for men. We have something called the boom and bust cycle, which very effectively may maintain an exhaustion disorder over time and actually precipitate new instances of falling down in a deep state of burnout. And how does it work? Well, unfortunately, one could say, the levels of exhaustion are not, like a flat line all the time, but energy levels fluctuate. Symptoms tend to fluctuate depending on a number of issues. So some days one may actually feel better and even much better and have more energy, feel optimistic about the future and less of a general sensitivity to sound, etc. So the symptoms are at a lower level. And those days, the general tendency is to get ideas about, like it would be fun today to do something, or yay, apparently I'm back in business. I feel really great today, so now let's take the opportunity to, get things done. And this leads to overexertion, which in turn leads to a worsening of symptoms. And during the worsening of symptoms, what we do behaviorally is that we withdraw, we isolate ourselves, we spend a lot of time overthinking, brooding, worrying, being self-critical, etc., and which itself creates a lot of stress for us. And we become generally very passive, which in turn leads to deteriorations at the physical level. We lose stamina, we lose muscular strength, we become stiffer, etc. And some people see that as a deterioration of the exhaustion itself, But a lot of passive rests, in a few days, maybe you're a bit recovered and then you have a better day, and this circle is perpetuated and exhaustion with it. So one of the most important aspects of treatment, rehabilitation, is to address the boom and bust cycle and see to it, to break it and establish another way of, being economical with one's energy levels, and do everything but at a level that is tolerated, and then slowly increase the activity over time. What else do we have? We have a number of psychological factors that explain why people get caught in the boom and bust cycle. For instance, denial. Many people find it shameful, or in other ways, bad to be one of those weak persons who become burnt out. So denying the fact that this is the case is something that may feel, in a way positive in the short term, but in the long run it becomes destructive, because if you cannot accept the fact that you have an exhaustion disorder, you won't do the appropriate things to get out of it. But, it's difficult for us sometimes. It's not really in line with our self-image, etc. Guilt and shame are also very common emotional reactions to exhaustion, and they could be expected. On the other hand, if we let them, command what we do on an everyday basis, we will probably start acting based on our guilt and shame, and do a lot of things that definitely will become counterproductive in the long run. Many people avoid going shopping at certain times, or being outdoors because they're afraid of meeting the neighbors or meeting colleagues who may ask questions about how one feels and what one's doing these days, etc. And in order to avoid that, one remains at home. And of course, these avoidance behaviors become very destructive in the long term. We also have I was saying a bit about earlier on, our uniquely human way of creating stress when there is no real stress to deal with, and that we do with our own thinking. So when we ruminate about our past mistakes, or we worry about all the possible catastrophes that may happen in the future, or we spend the time criticizing ourselves, well, that has its explanations even from an evolutionary point of view, but still we create mental images that actually are perceived as a threat at a certain level. So the stress reactions within the body are triggered by our own inner dialogue, and that is not a way of promoting a sound unwinding. It's not a good, way of trying to recover from a state of exhaustion. So this is also something that needs to be addressed in a treatment, for instance. Then in psychiatry and psychology, when we look at the pathological aspects of it, comorbidity is the rule rather than the exception. And some people have pre-existing disorders that have been not discovered in many instances, and which increase the risk for developing exhaustion under certain circumstances, like working within the public health force during a pandemic, for instance. And other disturbances may add to the exhaustion disorder and become secondary to it, okay? For instance, many people who are exhausted also develop a clinical depression or clinical levels of anxiety, while many others have a generalized anxiety disorder at a certain level as a risk factor for exhaustion, and then once they are exhausted, they have this generalized anxiety that maintains it. In my experience working clinically with this patient group for many, many years, I also see that a great number of individuals with an undiagnosed neuropsychiatric disorder, such as hyperactivity disorder, ADHD, ADD, but also autism spectrum disorders, what we, until a couple of years ago, called Asperger's disorder, have that as a risk factor, and that too works as a maintaining factor in the long term, and others as well. On the physical side, migraine, for instance, is very common. So now to wrap things up, a helpful perspective for employers, for managers, and for not only the leadership but also for us as individuals, is to see that there should be no stigma attached to exhaustion disorder, because what it is, actually, it's a normal reaction to circumstances that are not normal. Okay, so let's take the pandemic. That was definitely not a normal set of circumstances, and working hard and meeting so many challenges like many of us have done leads to a state of exhaustion. That's not strange at all. It would be strange if the opposite occurred. Okay. And another thing to remember is that it's not the weak individuals, the lazy ones, or those that are defect in any sense that develop this state. It's really what the strong ones do, because they keep being strong for too long time. So when trying to rehabilitate, when trying to treat people who suffer from this condition, we must remember that returning to work is not something that happens once rehabilitation is over. First you get well and then you start working, but you have to get well enough, and returning to work is a part of the rehabilitation. And in order to make it, work, make it sustainable in the long term, when returning to work, we cannot be focusing on being able to work as hard as we used to do immediately. Okay? So return to work has to be phased. It has to be a gradual return to work. And as an employer, we also need to follow the points, the bullets here that you see on this picture. I won't go through them all in detail, but there's a list that has to be kept in mind, particularly when we deal with individuals who suffer from conditions that are so long-term and protracted over time, that we have to be very careful and see to it that it's possible to come back in a way that is sustainable and prevent new instances of burnout within the same person as soon as they're back at work. So with that said, I'll leave you for today, and thanks enormously much for your attention. I'm really happy that I had the opportunity to come back and deliver the entire speech. There's so much more to be said about this, but if you want to get in touch with me, you have my email here. So thank you, and